Good morning, friends. I am so happy to be here. This is Dr. Rhonda Nelson, if you did not know and you're new to the crowd. So today, though, I wanted to talk to you about setting boundaries and how absolutely vital this is for you in your practice. Because here's what happens. We all know we've had this happen. The patient comes in, you have a great rapport with them, and they start asking you questions. And you very, very generously say, listen, send me your email. If you need anything, I'm happy to help. Well, for most people, they take that at face value, and no one ever encroaches. Like, they don't push the boundary, they don't push the envelope. They're usually pretty good about it. But then you have those patients that decide that, well, maybe I'll just start asking every kind of question via email. So they send you an email and they ask you a question about something that you talked about just to make sure that they have it right. You're happy to answer. And then the next question comes, and the next, and the next, and pretty soon you've got someone who's emailing you every single day or several times a week, or they're calling your office with questions, or when it's time for them to reschedule their appointment, they just don't want to reschedule the appointment. They say, no, I'm not going to do that, but then they keep sending emails. So this is what we call boundary creep. So this is where the patient is like, you give them an inch and they take a mile. And the other thing that happens is sometimes they'll just start asking questions for their, Aunt Martha or their husband or their grandmother, and we can't give advice or recommendations without knowing a little bit more about the situation. We always have more questions than back to them for their single question, right? So how do you set these boundaries with your patients? Here are my 3 best tips. Number 1, be very, very clear up front in your paperwork about what is allowed and not allowed. And I don't mean like a dictator would say, this is what we do allow and this is a no-no. But be very clear in your paperwork and say something like, we welcome your emails, but if your question cannot be answered in a few short sentences, then we reserve the right to request that an appointment is made so that the doctor can adequately address your concerns. So there's that, right? You can absolutely communicate that up front. Number 2, you got to make sure that your front desk staff, and if it's you, come on, you got to make sure you're doing this too. But if your front desk staff doesn't know how to handle that, then the patient can again start running the line out, right? It's like fishing. They're just going to run it as hard and far as they can. So you want to educate your front desk staff on how to communicate with those patients when they start asking these types of questions. How do you communicate with them? What do you say? Do you say, oh, I'm sorry, doctor will get right back with you, and then no follow-up is ever made? That's not going to work. So you want to let them know what to say, and the response back in the email should be along that same line. Listen, thank you so much for your question. I passed this along to Dr. Joe, and this is actually more than can be adequately addressed via email, so we need to schedule an appointment with you so that Dr. Joe, Dr. Mary, whoever can adequately address your concerns. And very, very often you'll find that the patients, they get grumpy and they get mad and they're like, well, you said. No, I said if I can't answer it in a couple of quick sentences, if it's not an easy question to answer, like, are sweet potatoes okay, then I need an appointment. So setting those boundaries, that's why having that clarity in your paperwork up front is absolutely vital. So that's number 1. So make sure that you're communicating it up front. Number 2, make sure that your staff is communicating it. And number 3, it comes down to you, my friend. This is where when you are sitting down with that patient, you can't say, hey, send me an email anytime, no problem. Because not everyone will abuse this, but some will. And that's where you have to just put your CEO hat on, right? You put your big girl hat on and you say, okay, here's how this is going to work. I'm happy to answer any questions that you have. However, if a question is too lengthy, too extensive, then I may ask you that we have a little phone appointment, or you can come in again and we can chat it out. But I'm committed to giving you the best care possible, and by doing that, I don't want to devalue or not give you the best information that I can by just responding to a quick question, because usually there's more to it than just what meets the eye. Your initial question, I'm going to probably have 5 or 6 questions back at you to try and understand it better. So there's 3 points that where you are able to set those boundaries with your patients. Number 1 is in your patient paperwork. Get really clear about your policies, and each one of you, really encourage you, have some kind of a set office policy. I always have one that I give out to my patients, not the practitioners that I work with, but on the patient side. I have this document and I give them, and it spells all of this out. This is what our cancellation policy is. This is what we have it under a communication policy. So these are our communication guidelines. I think ours say guidelines. Communication guidelines, and this is what it looks like. And here are our office hours, and here's when we're off on Fridays. Like, all of that is in there, and they get that as part of their paperwork. So that being said, all you have to do is, if you already have a document, just add a little paragraph in there. Make sure that your front desk staff knows how to respond. And when you can sniff out a question, hey, I want to ask a quick question about my grandma. Well, your front desk person should know right away. We got to go. That's a no. We're not going to do that. That's a no. If it's simple, like, can grandma eat sweet potatoes? I don't know. I don't know your grandma. I don't know. Does she have an allergy? I don't know. So it's just better to keep your communication with the patient. Try and not give outside recommendations for other family members or people you don't know unless you're talking to the patient one-on-one. So, really what it comes down to is we just have to train them. That's all. We just have to train them and guide them and let them know how we do it. And they may have had a different experience with another practitioner. Okay, fine. And at the end of your conversation, if they get all mad and pissy and say, well, you won't, blah, blah, blah. Guess what? They're not your ideal patient. Bye-bye. See you later. Because it's okay to say no. It's okay for a patient to leave. But we want to leave and have the best integrity that we can, try and resolve the issue, but you can't resolve an issue if you didn't set clear boundaries in the very beginning. So that's all I got for you today. Have a great week. I'm going to try and hop on a couple more times this week. I've got some things I want to talk to you about what I do every single morning that sets me up for a killer productive day. And so I'll hop on again this week. So check to make sure your notifications are on so you'll get notified when I go live. All right, you guys, take care. See you later and make it a great week.